Right then, little people, here's your follow-up video for mid to upper back stiffness, tightness in shoulders, into the neck, etc. First of all though, you lot who are doing Skype calls, Zoom meetings in your shirt and tie, listen, your kid know and your boss knows. So drop the act, get rid of it, and just go back to your dressing gown like you have been all day. Okay, that's better. Now we can all stop telling lies. We're in our dressing gowns all day long. Okay, so a couple of new tips for you for a little bit higher up into neck if you're suffering from headaches. It's all because you are sat for long periods like this in these awful dog shit positions. And what will fix you is having a bit of proprioceptive awareness, so body position awareness, developing some sort of balance between front and back, reducing some of this shortness on the front, increasing some tone on the back through activation, strengthening drills. But for today, we're gonna start a little bit higher. So, hands-on stuff, really important. So you have upper trapezius, so this muscle that effectively attaches your arm to the base of your skull. Some people have massive upper traps. Some people don't. Okay, so hand, reach across. Always use your other hand to support. So just wrap it on top of this one. Gently at first. Again, common sense prevails. Start light, and you can always work your way into it. As I pull my hands forward, then I will look over my same shoulder. Then I relax. Then I start again. And again, I might start a little bit higher. Your job is to explore and try and find areas where you think, oh, that is awfully nice. And then just move stuff around. Go and find resistance, go and find restrictions, anywhere that feels slightly uncomfortable. Don't go crazy on it, but get hold of it, put a little bit of pressure in, move your head around. Again, find angles that feel productive or feel effective. So you're going to pull from back to front, okay? Then in this area, again, really important, is you have scalenes. Again, these little guy ropes. What are we doing? This little fella's one of them. You're going to do what's called a pin and release. So I place a flat palm. Again, common sense prevails. Start light. And again, I'll support. And I'll just, again, that feels disgustingly nice. I'll just pull my head away. And I can feel tension all the way from my fingers up into the base of my skull. Underneath this occipital ridge. Again, find positions and find angles that feel productive. If you get sharp acute pain, either take some pressure off, don't move your head so far, or just don't do it for now, okay? It's not worth it. And do both sides, and generally you might find that once after a few minutes you're done, your head feels nice and light and wobbly. And again, it just takes some pressure away, or it takes the sensation of stiffness and tightness and potentially reduces your pain. It makes all this feel less tense, less tight, and a bit nicer. Okay? Going forward, again, all that does is desensitize. It reduces the feeling of this tension buildup. It doesn't fix anything. So what we might need to do is, again, have a bit of direction. Think about what's short, what's long, what needs more engaged, and certainly what needs stiffened up. Again, this is a concept that is lost on a lot of people. We always want the reduction of tightness, a reduction of stiffness. For some people in some areas, we need to improve stiffness. We need to create some stiffness, because what that does is it starts to reposition joints, and it allows what's called stacking. So it allows my head to sit on top of my neck, which is on top of my ribcage, etc., etc. Make sense so far? No, I'm talking very fast. So for now, again, if you have this forward head position, then our deep neck flexors are doing nothing, zero, onion rings. So what I might do is, again, reposition my head. And again, this is nonsensical, a pointless position to be in unless we influence it or have some sort of structure there. So I'll place my hand on the back of my head. And what I'm trying to do is I'm trying to push my head forward. Again, common sense prevails. Start steady away. You don't have to pull your head off. Oh, bloody hell. And I'm trying to push forward, and my deep neck flexors resist this position.
Neck extensors, so Daniel. Extensors, not flexors, you bloody idiot.
and I can do that anywhere I want. Again, find myself in a better position here, add a bit of side flexion pressure, and what you find is these, again, deep neck flexors, the lateral flexors, engage. And I do this side, and I engage. And you can manipulate lots of things. I can manipulate how hard I push and how hard I have to resist, how long I do it for, how many times I do it for. There are lots of things that you can manipulate to suit you. And again, the rules change depending on you and your pain and your symptoms and how it feels and how you respond. If you respond well to 10 seconds and doing each side alternative, carry on doing that. What that does, like I said, it creates some tension, it creates stiffness. And what we have here is a lack of stiffness, which allows this poor, shitty, shoddy positions. Okay? So that's what we call isometric strengthening or isometric engagement. And isometric is a posh word for nothing moves. Okay? So we create this stiffness and this tension in a good way to help ultimately reduce all these symptoms of stiffness. And then it sounds like a bit of an oxymoron, but it works. Following on for that, if you have a band, if you don't have a band, don't worry, stick to your manual treatments, stick to your isometric strengthening, again, generally really works. If you have a band, then we can add some eccentric concentric. So I allow myself to start in this shitty position, then I just push my way out of it. And again, I might as well use ribcage, thoracic spine, and again, I can isometrically hold, I can stay here, or I can relax, concentric, push back, relax, push back. And again, what I'm trying to do is create stiffness, create some sort of activity in these muscles that have been disengaged, sloppy position. Make sense? Digging me about it. So, get out your shirt and tie, you're kidding no one, get back in your dressing gown, be productive, work on these poor positions that you find yourself in. By bit hands-on manual treatment, again, just to desensitize, make it feel nicer, but you have to be working on some activation drills or some potential strengthening. Any problems? Comment in the link below or above, depending on where you're seeing this, and share, if you don't mind, that would be great. And enjoy your dressing gown, people. All best.